Hi, it's me, Dr. Sheila Dobee from Your Caring Dentist. I wanted to talk about masks today because there's a lot of kind of controversy around masks. So I kind of just wanted to kind of share with you some of the research that I've done, just kind of make it a little bit clearer what's going on with masks. So first of all, there's different kind of masks. The first are the medical-based ones, the N95, the KN95s, the FPP3s, and all that kind of stuff. So those masks are healthcare worker masks. There's a huge shortage right now. A lot of these masks are made in China. There's difficulties in getting them across. There's shortage, there's global issues, shortages of these masks. So it's very difficult to get hold of these masks, and we should really keep them for the healthcare workers because it's very important to keep them protected and safe because we need them around to take care of all the sick people that are out there. And we also need them to be safe for their families because they're doing us such a wonderful service. So thank you again for all the healthcare workers that are out there. Thank you for going to work and protecting us. So the next thing is, there's also a level 3 surgical mask. Now the issue with those and the main issue with these surgical masks and the level 3 mask is basically the protection that goes around. We want a really tight seal that goes around your nose and your mouth areas to prevent virus coming in and coming out. So the level 3 surgical masks, although they're really good with filtration, they're kind of opened up. And there's some techniques that you can go through, and I kind of have shared with my colleagues, my medical colleagues, on how to help convert these level 3 masks into kind of tighter fitting masks so that they're just better surgically sealed. I'll add that video into one of the other YouTube episodes that I do. But for the general public, those masks are reserved ideally for the service professionals. Now, at this point, we are talking about making your mask. So if you're going to make a mask, there's a couple of things. One, you want to make it nicely snug and fit. So the tighter it is around here, your nose, covering your mouth, the better it is. The second thing is you have to be able to breathe through this thing. There is no point in making a mask that you can't breathe through and then passing out. That's just defeating the purpose of making a mask. The third thing is when you're making a mask, you have to try and make it a couple of layers, because think about this virus particles, this tiny little thing that's out there creating crazy havoc in our world. And we've got to prevent it coming through. And one of the articles I'm going to add into this YouTube channel just basically shows that there's a couple of materials that you can use, and ideally different materials, maybe a bit of cotton, maybe a bit of silk materials, and that kind of increases the efficiency of your mask, right? So now you've got your mask, a couple of layers, and it just makes a better mask. The other thing that you need to look at is, if you're going to make a mask, make a couple of them, because ideally you don't want to keep reusing that mask, because if you're reusing that mask a lot of time and there's virus on there, that's just going to increase the chances of you getting virus in your system because you've got a dirty mask. So what you want to do is you want to get used to kind of having a mask, and then when you're done using it, just taking it out. And if it's something that you're washing, just putting it in a bag or something, and then you can take all the masks and then just wash them all in one go in a washing machine under hot water. And there's a lot of articles out right now that are talking about different ways of disinfecting these masks, like UV light. But we have to also be careful with what's out there, because there's a lot of people selling things that just don't work and kind of frankly monopolizing on this really bad situation that's out there. So we also have to be careful, because you don't want to be buying something that doesn't work and then you think it's working and then you're just kind of just using something that's really dirty because you thought it was getting clean. So that we've got to avoid those, and that's probably something I'll look at in another YouTube channel, just kind of in another YouTube episode, just looking at how these to get these masks clean, and I'll do some more research on that. So you have your masks. The other thing is, once you have these masks, and by the way, if you're trying to look at how to make them, there's a couple of YouTube links on there. CDC has a link on how to do that. I'll add that onto this YouTube channel also. I know there's different places that kind of showing you how to make very beautiful fancy masks, but you can easily find those online. The key is you just want to make sure the snugger the better and the tighter the fit, so that but you can breathe, the better it is. The other thing is, it's very important on how you take these masks off, because there's no point in having these dirty hands and then kind of adjusting your mask, and the next thing you know it, you've got virus on your face. So once you have that mask on, that's it. Just leave it on and don't adjust it, because you might have dirty hands. Think about this. If you go out with a mask and you touch anything, it could be your door handle, it could be something in the grocery store. Now these hands are dirty and you haven't, let's say, had a chance to sanitize them, or you haven't had a chance to wash them. These hands are dirty now. So you can't touch any part of your face or your hair or anything and adjust mask with them. And anything you touch after that, if you're touching your wallet, you're touching your keys, this also now needs to be ideally disinfected at some point when you get home. And I know this is really difficult. So we, as a dentist, we've always kind of been learning for many years how to get really strict on our infection protocol. And so it just kind of comes naturally to us. We know how to surgically scrub, how to make sure we're not touching even the soap thing. We're like doing things with our elbows. We kind of know how to work with it. So I can't imagine what it must be like for someone that has no idea about infection control and cross-infection to kind of suddenly be out there with these masks and sometimes gloves, and like you're in some kind of ER episode, but you just don't really know how to use this use these masks correctly. And that's why I decided to do this video, because I didn't find anything too useful online. So when you go home and you've got your mask on and you're able to wash your hands, that's when you can now remove this mask. But you don't want to touch the outside of the mask, because that's where you could have some virus particles on. So you kind of want to take it from the back and then boom, and then into your container or wherever you're washing, where you're going to be washing it. So it's very important how you handle these masks. Okay, I have to share with you this really cool meme that I saw on the internet explaining this mask situation. So I'm going to share that with you right now. Okay, ready for it? If we all run around naked and someone pees on you, you get wet right away. If you're wearing pants, some pee will get through, but not as much, so you're better protected. But if the guy who pees also is wearing pants, the pee stays with him and you don't get wet. Is that clear enough? Genius. So that kind of explains it. Now, the other thing about masks is there is another link that I'm going to add on here that is it's an interesting study that they're doing about the projectile of this virus. Now, remember, when this virus are tiny, tiny little particles, when you cough or when you sneeze, it kind of goes out into the environment. And the thing is, if you wear a mask, sort of less of it comes out. So this article is kind of interesting because it kind of shows you, they do this simulation of this cough. If you cough, it can actually go beyond 6 feet. So 12 feet. So that now questions, if someone coughs, how safe are you from the social distancing? Now, obviously, there's different aspects of this point. For example, if you're coughing and is just a little bit of viral particle, is that going to cause you to get COVID, or does it have to be a big amount of virus for you to get it? So that's what they're currently studying. But this study that they're doing shows you that even 12 feet away, these viral particles kind of get out there and they're suspended in the air for a few minutes if there's a circulation. And obviously it's different if you're in a closed room and there isn't circulation, that viral particle can stay in the environment. That's why social distancing is very important in conjunction with wearing a mask, because obviously the further you are from someone, if they do sneeze, the less likelihood you are to get the virus. So it's really important to take that seriously. And it brings me down to something else. The other day a friend of mine sent me a picture a couple of days ago in San Francisco, and people are just hanging out and about, and they're kind of just socializing, and there wasn't much social distancing and nobody was really wearing masks out there. Now that brings me to a point, is it just takes one individual to contaminate somebody else and kind of start all over again. So we have to be responsible, otherwise we're going to end up in another lockdown situation, and this time the government are probably going to be even stricter, because it's kind of like having kids that don't listen, and they'd be like, hey guys, this time, we gave you some freedom and you clearly aren't responsible, and look at you now it's going to be even stricter. So let's be responsible so that we don't get punished by the government and our parents, for example. So we really have to take this responsibly. It's also it's also our responsibility to take care of fellow humans. Like, it's not difficult to wear a mask, and it's not difficult to socially distance. It might be inconvenient, but we really need to take care of our elderly and also people that are prone to kind of potentially getting this disease in a serious way, and maybe even it being fatal for them. And it's the human thing to do. So it's really important for us to take care of each other at this particular point and be responsible. There are countries out there that are super strict, like when Italy did a lockdown, like they were like super strict. And we are lucky in the US, we had shelter in place, and we shouldn't take that for granted. And we shouldn't take the fact that we were able to kind of go out, grocery store. It wasn't heavily enforced. It was done in a way that we could handle it. And obviously, I know there was a lot of people out there that are having a tough time because it is increasing the stress and the anxiety. And I've done a few videos on stress and anxiety relief on my YouTube channel. So please do subscribe and check out those videos. So back to my point, please socially distance. It does help. The sooner we can kind of get these, eradicate this issue, the better it is for all of us. Obviously, it's going to be around for a little while until they figure it out. But just remember, don't lose faith. The whole world is working on this right now. So some brain out there, some companies are going to figure out something. It's just a case of just buying time. And remember another thing, that the more time that we're in this situation, they're figuring out how to come up with cures, like vaccines or whatever, but they're also working on the protocol on, if you do get it, like what helps. And that means that, if you do get it and it's a little bit later on the line, they'll actually know what to do and how to handle it. So on that note, I hope this was a valuable video for you. And if it was, please share it with your friends and your family. And don't forget to subscribe. Here's to a happy, healthy, and vibrant life. Till next time.